Good afternoon, everyone. I'm Blake Curtin, joined today by Sean Khalid, Peter Haroon, and a special guest to discuss a very important subject, long-term care. According to the U.S. Department of Health and Human Services, 70% of people turning 65 years of age will need some type of long-term care services during their lifetime. Yet fewer than 4% of the population have long-term care insurance. What if you knew there was a 70% likelihood that homes in your neighborhood would suffer serious damage from a storm, fire, other catastrophic events, yet only 4% of your neighbors insured their property against loss? Would you want to be among the insured or the uninsured? Some people believe bad things won't happen to them, and we certainly hope that is the case. However, hope alone is seldom an adequate strategy when it comes to protecting yourself and your family. Former First Lady Rosalind Carter, who passed away just 11 days ago, hit the nail right on the head when she said, "There are only four types of people in this world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver." In which category or categories do you fall? Even if you beat the odds and don't require long-term care yourself, it's very likely that you will be a caregiver to someone in need, if you already aren't. Some people believe Medicare or other healthcare insurance covers the cost of long-term care services. Let's be clear, it doesn't. And some people believe they have sufficient financial resources to pay for long-term care. Perhaps they do have the means to fund their caregiving needs. However, what effect will those expenditures, which can easily reach six figures, have on their family's financial well-being and the legacy they may want to leave them? We're delighted to be joined by Tyler Schaefer, an insurance specialist with Nationwide Investment Services. He's a graduate of The Ohio State University with a degree in business, and he's highly credentialed. He holds the designation of Chartered Life Underwriter, the most respected insurance accreditation in the life insurance industry. He is also a chartered financial consultant with an in-depth understanding of comprehensive financial planning. And Tyler is a certified long-term care professional helping firms like EQ and our clients address ways to mitigate the potentially devastating financial consequences associated with individuals and families facing a myriad of long-term care needs. Tyler, a study recently released by the U.S. Bureau of Labor Statistics reported that over 37 people million in this country are providing unpaid care or elder care to individuals 65 or older because of conditions related to aging. The majority of these elder care providers were women. For many women caregivers, not only may they be caring for a parent or a grandparent, but they may also be responsible for their children still living at home. We refer to these people as members of the sandwich generation because they're in between two generations that require care. Tyler, can you give us your thoughts on this?
Yeah, absolutely. Thank you, Blake. The sandwich generation aspect that you just touched upon, I think plays directly into some surveys that Nationwide Retirement Institute has done where it shows 80% of people prefer to receive home-based care. And we really think that has to do with a myriad of reasons, but one of which is what you just touched on, the fact that, they might have kids of their own as being the primary caregiver and they're taking care of a parent. It really leads into that next kind of term, which is informal caregiving. And what that term really means is it's any family member, friends, neighbor, or anyone really not qualified by a specific designation or classification, and are generally unpaid. And what we've noticed is the fact that 61% of these unpaid caregivers happen to be women, which is an interesting aspect of if we did a survey of the top three caregivers in the industry, right? For informal unpaid caregivers, the first is going to be the wife, then it's going to be the daughter, and then it's going to be a daughter-in-law, which I find very, very fascinating in the fact that, back in the, previous decades, we would kind of assume to see those in the, women being the primary caregivers. And although they have been the backbone of caregiving for all of those years, as you know, Blake, caregiving is fast becoming equal opportunity for both genders. Blake, I think you're on mute.
Thank you for that, Tyler. Those are very important points you just brought up. Women certainly play a major role in caregiving. However, another recent article I was reading in the Wall Street Journal caught my attention. It was titled Caregiving Sons Face Steep Learning Curve. The author, Claire Ansberry, described the struggles of an adult son caring for his mother who has Parkinson's disease. He gladly, lovingly put his life on hold to care for his mother. However, he worries about doing so during his prime earning years, and he wonders if he'll ever be able to make up the financial deficit he finds himself in. While his mother, so grateful for his help, feels sad for the burden she has placed on his shoulders. What are your thoughts on this, Tyler?
Yeah, absolutely. Like, I think we'd all like to imagine that any child, including ourselves, would be able to drop everything and take care of our parents who obviously took care of us for all of these years. But the reality of the situation is there's really three factors that come to caregiving, right? There's the financial side, the emotional side, and the physical side. Financially speaking, one of the things that I think is always prevalent is how do we minimize the financial aspect? Because the emotional toll and the physical toll are things that unfortunately are going to happen one way or the other. Now, again, our task is how can we limit the financial burden and have it feel more like a plan that we set in place versus that of which the our author you were just talking about, the son was thrust into this situation. I've prepared a brief slide kind of showing the financial aspect of it and how Nationwide's done its own research and shows the real impact financially. So as you can now see on the slide, we've already touched upon informal caregiving and how 80% of people want to receive that care in home. But the financial aspect of it is on average a $300,000 lifetime loss in income and benefits is what's waiting for those informal caregivers, the unpaid caregivers that we were talking about. And that's 25% of those individuals had no choice when taking up that caregiving role. So again, that burden that was kind of thrust upon them, unfortunately, they stepped up when their number was called, but they didn't really have a choice. And to make up for that, that time taken away from work, I mean, it's 31 hours per week that they're spending on this unpaid care. And majority of these individuals have to cut work hours, pass up promotions because they can't take the extra time required for all these new responsibilities, or ultimately be forced to quit, take a leave of absence, or retire early. Again, I think one of the aspects of caregiving that we're trying to address, Blake, is the financial side. But I think we can all agree, like I was stating earlier, there's a variety of other factors when it comes to receiving and giving that care. Do you have anything to add on that, Blake?
Tyler, you're so right. Thank you for bringing that up. Unpaid caregiving by family members can take a heavy toll on people, financially, emotionally, and physically. In a heart-wrenching book by Kate Washington titled Already Toast: Caregiving and Burnout in America, the author describes her experience caring for her husband, a college professor incapacitated as a result of numerous health issues, while raising their daughter and trying to maintain her career. Even with more financial resources than most caregivers have, her caregiving responsibilities led to extreme stress and burnout, affecting her mental and physical health, relationships, and quality of life. For caregivers with fewer resources, she describes how the demands of caregiving can be exponential, often crushing.
Yeah, Blake. So one thing that I think Kate Washington nails completely on the head on this one is the big misconception when it comes to long-term care. Because even with more financial resources than most, that scenario, right, there was still all that emotional and physical toil that was thrust upon the caregiver. What I thought was interesting is one of the studies that we did, we actually saw that the health of the caregiver deteriorated quicker compared to the one receiving that care. And my instant question was, well, how could that be? I witnessed my own mother take care of my grandfather, and I thought everything was fine. But then it dawned on me, my mom and her situation was so focused on taking care of my grandfather that she really focused only on that and not her own health. Priority number one was caregiving. So what I want to talk about next is another misconception, which like you mentioned on earlier on, are the fact that there are some long-term care misconceptions when it comes to some of the social plans that are out there at this time. Again, I prepared another slide to briefly go over the Medicare misconception that's going to be out there. Now that you can see the slide, Medicare is one of the options that people typically think will be able to help cover them during this type of event. The reality of this situation is really you have a maximum of 100 days of care only after the third consecutive day in hospital under treatment. And that care is only really covered skilled care only, and it usually has a lot of restrictions. How I always like to think of it is when you're going through a public plan, there are typically some red tape and some hoops to jump through because really it's a social safety net. It's really meant to help those who are unable to help themselves. And I think another misconception that really plays into this as well is the Medicaid aspect of it. Because with Medicaid, individuals think, okay, this is really focused more towards healthcare and long-term care type planning. However, the reality of that situation is you have to meet some certain criteria to even be able to qualify for that. One of which is you have to spend down all of your assets in order to meet the financial eligibility of the program. And those assets are very, very, very small. You have to have accountable assets of less than $2,000. And then the government needs proof that you're impoverished at that time. Now, there are some things that are excluded from that, what is counted towards those $2,000, but the vast majority of the individuals in America, and especially on this call, aren't really going to be wanting to rely on Medicaid. Because if anyone's gone through a long-term care event, whether it be a family member or a friend, and they were in a Medicaid nursing home, it is something that is not truly ideal for their situation. It's really, like I was stating earlier, it's that social safety net. And those social safety nets are really meant for those who are unfortunately unable to really take care of themselves. I always ask this, whether it's advisors or clients alike, I usually get a resounding answer on this, is when given the opportunity to have something that's publicly ran or privately ran, vast majority of individuals want that private plan. Why is that, right? So, because you can personalize it. You know exactly what you're getting. It's geared and built towards you versus those social safety nets where we're trying to grab as many people as possible to take care of them. So Blake, I think we've covered some of the general misconceptions when it comes to long-term care planning, but does the EQ team want to add anything in their experiences with this discussion?
Thank you for your insight into that, Tyler. Peter, I know that you often speak to clients about long-term care and developing strategies to address the situation before people get that phone call that comes out of the blue. Can you tell us what that phone call is usually like?
Thank you, Blake. That phone call might go something like this. You learn mom fell and broke her head. You rush to the hospital to be with her while a sibling, hopefully your sibling resides nearby, rushes to the house to take care of dad, whom your mother was caring for. They may both require long-term care and assisted living services because it no longer seems like it's safe for them to live alone. Life seems to have turned on a dime. And the decisions only escalate and become more complicated from there. Who's authorized to make official healthcare decisions for them? Have there been discussions about preferred or available living arrangements to deal with such circumstances? Who has the legal authority to make financial decisions for the parents? We believe that our clients and their families should discuss and develop transition plans for these types of situations before they occur to help reduce stress, uncertainty, and poor decision making during difficult times for all family members. Tyler, I'd love to hear your thoughts on that as well.
Yeah, absolutely. Thank you, Peter. I couldn't agree more. One thing that I stress with both clients when I'm having this discussion or advisors that are new to the area, I like to focus on the fact that the product solution, whatever plan you pick, is just the funding of that plan. Really what we're focused on, like you were stating, Peter, is what's the entire plan? Who's given that POA for the health or financial decisions? How does mom, dad, myself, or whoever else we're planning for want to receive that care? And who's going to be the primary caregiver? I'm going to ask everybody to kind of put themselves just in my shoes in this example of my situation when it comes to my parents. So for me, I live obviously out here in California. All my family's back in Columbus, Ohio. I have two siblings. They live within 10 miles of my parents, very close. But if an event were to happen, what really is my responsibility, or what can I bring to the table in these events? Really, all I can do is help from the financial side. I'm not going to be able to fly out there consistently, be able to help on the weekends or what have you. So do my siblings know that they are really being relied upon to be those primary caregivers. Maybe it's assumed, it's implied, but hasn't explicitly been stated, so everyone's on that same page. To me, the question now becomes who should start planning and when? And another thing I like to point out with the slide that Nationwide prepared is we can start with the vast majority of people because it really should be focused on anyone who has assets to protect or pass on to their heirs. For example, any homes, property, retirement accounts. Again, my situation, my parents have a lovely home in the suburbs of Columbus, Ohio. I know they're going to want to pass that down to my sister. How do we make sure we keep that part of the planning? That way a long-term care event doesn't require them to do anything drastic, right? And again, what I want to make sure that people are also aware of, it's not just for the elderly. I can't tell you how many people I talk to that are between the ages of 45 and 65 planning for this because they've dealt with a family member or a loved one going through this, and they understand the importance of it. You know, the industry looks at this as, hey, it's nursing home insurance, and I couldn't disagree more. Because again, this is really focused on protecting any of those assets and making sure you're receiving the type of care that you want to receive. And looking at ages between 45 and 65 who are able to secure some coverage without depleting their assets because you're younger, it's a little bit more affordable. But more importantly is, at the end of the day, our task is to prevent a long-term care claim feeling like a burden to our loved ones. So the sooner we're able to have that conversation and be able to address that, we're able to earmark some money and put it aside to provide that leverage. And I think this is a great start to some of the EQ team experiences, right? Blake, what else is worthwhile to go over today?
Tyler, your insight on the importance of starting the discussion on long-term care earlier than later is very pertinent. Peter, I'd like to ask you, what are some of the most important issues that clients discuss when it comes to preparing for long-term care possibilities?
Sure, Blake. One question, the very important question that we all need to consider is, am I or are we wealthy enough to be able to self-insure? What effect would self-insuring have on our spouse or children who I need or want to provide for that long-term care expenses would take away from? Tyler, I'd love to hear your thoughts on that.
Yeah, absolutely. I want to address each question individually. So to your first question about am I wealthy enough to self-insure? The answer, unfortunately, is maybe. The real question is, do we want to self-insure by default or by design? Because what I'm going to show you next is the average cost of care when it comes to across the nation, when it comes to long-term care and the different types of care. If we are planning focused on this, where maybe nursing home, again, that's where everyone's minds like to go to, the average cost being let's just call it $100,000 a year. Do we have that available? Very few people, I feel like, want to be able to just pay that out of pocket without putting something away now to help take care of it. I think the real problem is, again, we might have the assets, but do we have the ability to make it liquid immediately? And then to your second question of what effect does self-insuring, if we choose to do that, have on our spouse or children, and what do we need to kind of plan around that? It really comes down to, the easy answer is yes, it's going to deplete however much you're leaving back to your heirs by however much your claim is. But I think the more complicated, question to that is, how does that process work, right? Okay, yes, we're leaving less, but do you have $100,000 a year to take out of your cash? Or, unfortunately, is it something where we don't have this unplanned expense, tallied for, and we're going to have to liquidate an asset maybe quicker than we would like to, maybe it's not the right time for it, and we end up earning less on it than we really could have if we are able to be patient, right? Very few people have the ability to self-insure and have a minimal to no impact on their legacy planning to their heirs. But I will say this, every situation is going to be unique. So although we can look at average costs and see how everything works, working with your EQ team is the best way to figure out what's the best solution for your individual situation. And I think speaking with Peter and Sean at EQ and allowing them to help determine those best solutions are the next best steps.
Thank you for your thoughts on that, Tyler. Peter, are there any other questions clients should consider about long-term care?
Yeah, Tyler, another very important question that always comes up in our discussions is, am I or are we insurable? And what's the risk of putting the decision off for a little while? Because there are more pressing things to deal with right now.
Absolutely. These are great questions. I want everyone to realize that some of the solutions out in the market that your EQ team are going to help you look at and review require what's called underwriting. That means not everybody's going to be able to get it. Some people, unfortunately, are going to be what we call uninsurable, or could be a decline when it comes to coverage, just because the risk is too much for us, since you could go on claim here shortly. However, to get ahead of this though, Nationwide offers what we call pre-screening. So we can work with your EQ team, get a list of some of your health conditions if you have any, and we can run it by an underwriter to see if you're able to be a good fit for the product. That way your EQ team knows what options are on the table. We're all aware that there really is no perfect timing when it comes to anything in this world, whether it's buying a house. I joke this probably makes more sense back home where it's a little colder. Replacing a furnace in a home can be very expensive and you have to have that done. The timing on that is never great. Or like we're talking about today, just getting any sort of insurance. But the reality of the situation is the longer you wait, unfortunately, it means that the product is only probably going to get more expensive, but more likely the fact that your decline rate is going to increase as well. Unfortunately, once you hit the 70-year-old or above threshold, your approval ratings start going downhill. So again, with our target market going back to that previous slide is really 45 to 65. That way we can make sure you're insurable. Because I can't tell you how many times I've started the conversation with a client and their advisor. Hey, we want to look at this. It's great. Timing right now is not that great. Let's revisit it in a year. And sure enough, I get a call 9 months, 10 months, 11 months later saying, hey, so-and-so wants to continue this conversation. My first question every time is, well, what happened? And unfortunately, majority of the time it's, they actually had a fall or they went to the doctor and found this or what have you. Life happened. And now their insurability aspect of it is becoming more and more difficult. Because I think the best thing to really focus on is, again, the timing might not be great, but sooner the better just helps increase your likelihood. And your team here at EQ can help get ahead of that situation and help with the transitions in life when it comes from retirement to receiving that care. Because again, even if you're not able to get one of these plans that I'm alluding to today, there's other options that your EQ team will be able to help address. And again, I say all of this not to scare you by any means. I know I sound like Chicken Little a little bit, the sky is falling. However, I firmly believe that there's never a perfect timing for this. Life always happens and it'll always get in the way and you'll always want to wait. But again, the sooner you're at least having that conversation and looking to apply, the better. Because at the end of the day, there's no cost for applying. And if the coverage is approved, you have your final meeting with your EQ team and you decide now it's not the right time, you at least know that you are able to get it. You went through all your options, whether you should proceed or not.
Tyler, thank you for your thoughts and insight on this subject matter. I think Blake and Peter were able to ask you some great questions. You obviously shared a lot of great insight. I just also want to say one last thing. Look, in the last 20 years I've been doing this. Time has given me the opportunity to see things with my own eyes as well too. And this is not a pleasant conversation to have with a lot of clients. I mean, it's not a pleasant thought to have with your family members. Obviously, it's not a pleasant thought to have with your loved ones, but it does require a lot of planning. And I'm really glad that you brought up some of these important key points into this conversation. And to all of our audience, look, it's very personal. It's very emotional subject. It's not just a financial consideration, but we just want to know first and foremost that we're here to listen. And if you have any question that has come up for your specific needs or situation, please don't hesitate. Give us the opportunity. Let's have a conversation around this, because for us, it's an honor and privilege to be able to assist our clients in building, managing, and helping them preserve their wealth. And helping them throughout life's transitions, planned or unplanned. This is one of those subject matters that we just keep talking about, the unplanned. Nobody wants to experience long-term care, but you were saying in the beginning part of the call that almost 70% of the population at some point experiences that. And I think it's so important to have that plan around that, at least a discussion point. And we're here to help listen and give you any feedback as that you may need. So with that being said, thank you for being a guest on our webinar today. We hope everybody here enjoyed it. One last thing, you will receive a survey at the end of this. We would love to hear your thoughts. They're going to be anonymous. We want to make this better. So if you could please share that would be great with us. With that being said, thank you for joining us. We're here for you and we wish you all the best. Thank you.
Thanks again, everyone. Thank you, Tyler.
Thank you, everyone, and thank you, Tyler.
Absolutely. Thank you.